most unbelievable things I had ever seen in my career up until that point. And so that was in 2004. And I really started to get into the power of diet and lifestyle for disease after seeing, after meeting Karen. She basically changed my whole perspective on healing. And when she essentially cured her, she was 95% healed from her lupus, which I was terrified I was going to kill her with all the medicines I had put her on. And she was off all medicines. And she came in with a stack of journals and books to educate me, because it's
Wow.
not something that we learn in medical school. And like other doctors, I sort of put it aside actually for a few months, because it was almost like I had trouble even conceiving of such a dramatic reversal. But then one weekend I brought it home and sort of devoured it, and my life changed.
So when she healed herself of lupus, or at least 95% of the way, what were the things that she was doing? You said she was completely off medication. It was just lifestyle and nutrition.
Yeah, yeah, she had gone on what's called a nutritarian diet, which is popularized by a doctor by the name of Joel Furman. It's a beans and greens diet, basically, mostly vegan, but he wouldn't call it. They don't really call it vegan because the diet does accept a little bit of animal protein if you're highly active, but generally speaking, it's a high nutrient dense diet. That's sort of how it would be defined, and that's the diet that she went on, and subsequently have seen many other reversals of conditions of people going on that particular diet as well.
Wow. Do you feel like, are there any, like, how do you determine whether or not that particular diet might be beneficial for somebody? Because again, that's relatively restrictive. I mean, from the standpoint of most people are eating protein and animal products on a regular basis, obviously besides vegetarians and vegans and whatnot. But what are things that you might see? Is it something in blood work? Is it something in skin conditions? What things tell you this beans and green nutritarian diet might be something that is beneficial for this person?
It depends on people's lifestyle. Not everyone is going to really accept that, and I always give the caveat here that when people get in, I present diet and lifestyle as an option to all of my patients, but very few of them will take me up on that option. It's 1 in 200. I've counted actually. So it's roughly 1 in 200 people who will really take, because we're talking about massive lifestyle diet and lifestyle changes. And so, it's a life change when people do that. In terms of the type of diet, yeah, it depends on
1 in 200 people. I'm sorry, I got to cut you off there. Sorry to interrupt. 1 in 200 people. I mean, I would have expected the number to be low. I don't know if I would have expected it to be that low. Um, are there any conversations with those people about, okay, if you're not maybe willing to make this extreme of a jump, what about like this small thing? Like, do you try to dial it back, and so the magnitude of the change isn't as daunting?
it depends on the condition,
Yeah.
honestly.
Because is it like a certain only magnitude of change might be the only thing that's beneficial for them? If you only make a small change for a certain condition, it's really not going to make any difference.
Yeah, well, for example, for autoimmune disease, it's hard to make just 1 or 2 changes.
Hmm.
For something like, let's say, acne, as an example, for acne, um, most people with acne have a high, say, fasting insulin, generally speaking, and so you can lower your fasting insulin. This is basically early insulin resistance, super early insulin resistance. In those particular acne patients, just using that as an example, you can get uh, if they get rid of high glycemic carbohydrates and in that particular case dairy, um, you can see acne improvement. In other conditions, there's another condition called hidradenitis, which is like a really awful disease where people get cysts under their arms, under their breasts, and same thing there. If you can really get their insulin level down, fasting insulin level down, through just modification of their diet, you can see improvement. But when it comes to things like autoimmune disease and, let's say a patient had heart disease or already had a heart problems, if you really want to see reversal of those things, you really have to be on a total lifestyle. change. I mean, total change in their diet and lifestyle.
Let me continue to talk to the 1 in the 200 person out there who is potentially willing to make some of these changes. Like you said, the high fasting insulin that can be managed and worked on with behavior changes and diet changes that are not necessarily that extreme. It's over a period of time. If you, like you said, diminish your intake of lower your intake of high glycemic carbohydrates, and that's going to really help. What are some of these more extreme lifestyle changes that you're presenting to people that you're communicating to them might have a drastic impact on their health that they're not willing to do, assuming that somebody listening right now might be the person that's like, I want to know what might actually help me. I am the 1 in 200 person who doesn't want just a quick, easy fix, who might actually not worry just about want a pill, but they're willing to make some changes.
Yeah. Well, you can look at it two ways. One is there are di diets that you can go on that are just elimination diets, where you're getting rid of say gluten, dairy, the main allergens. In those particular cases, you that's one way to start, and sometimes you can see improvement. But on the second side of things, we didn't really have these tests back in 2006 when I sort of started in this journey, but there are gut tests now that can give you a good indication of how healthy your gut is, and sometimes just correcting the things that you see in that gut test by either by going on certain, again, also potentially some supplements, as well as some probiotics potentially. Most of the people have, some problems with gut permeability. So you can create kind of a list of no's, yes foods and no foods, as an example. So you can try your best, but ultimately, for long-term health, they really have to make pretty substantial changes.
Yeah, for sure. Now, I'm sorry to belabor this point, but I just think it's so interesting. I'm big into the psychology of why people don't do certain things that they think might actually lead to positive changes for themselves. Do you think that like the 199 people who are not willing to make the change, and it's going to be impossible to come up with like an exact percentage or like exactly answer this question, but do you think that a lot of those people are simply not willing to make the change, or what percentage of their unwillingness to change do you think is attributed to maybe their lack of belief that if I make this change, there's going to be any difference? Because I think there is still a lot of lack of belief that just diet and lifestyle can make that dramatic of a difference. And I think that's where a lot of people don't have that connection of this can really make that big of an impact.
That's a very good question. There's no question there are people that don't believe that's the case. But there are other factors. One is that we are conditioned as